Multiple myeloma is a rare but complex hematologic cancer that arises in the plasma cells, a type of white blood cell found in the bone marrow. This cancer disrupts the normal production of antibodies and can lead to various health issues. In this comprehensive guide, we will delve into multiple myeloma, exploring its staging system, prognosis, promising therapeutics, challenges in treatment, FDA-approved medications, risk factors, and support resources. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101. Quick tips to help you survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Understanding multiple myeloma, often referred to simply as myeloma, is characterized by the abnormal proliferation of plasma cells in the bone marrow. These cancerous plasma cells crowd out healthy blood-forming cells, leading to a range of symptoms and complications. Myeloma cells can also produce abnormal proteins, referred to as M proteins or monoclonal proteins, which can be detected in blood and urine tests. Staging system for multiple myeloma. Multiple myeloma is typically staged using the International Staging System, ISS, or the Revised International Staging System, RISS. These systems take into account factors such as the levels of certain blood markers, beta-2 microglobulin and albumin, and chromosomal abnormalities identified through cytogenetic testing. Stage 1, patients have lower levels of beta-2 microglobulin and albumin, indicating a more favorable prognosis. Stage 2. Patients fall between Stage 1 and Stage 3 in terms of these markers. Stage 3, patients have higher levels of beta-2 microglobulin and lower levels of albumin, indicating a less favorable prognosis. Prognosis for early stage versus late stage multiple myeloma. The prognosis for multiple myeloma varies based on the stage at diagnosis. Generally, early-stage myeloma, Stage 1, has a more favorable prognosis than late-stage myeloma, Stage 3. However, it's essential to note that multiple myeloma is considered an incurable cancer, and treatment aims to control the disease, achieve remission, and improve the patient's quality of life. Early stage, multiple myeloma, Stage 1. Patients diagnosed with Stage 1 myeloma typically have a more favorable prognosis and may experience longer periods of remission. With advances in treatment, some patients can live for many years with well-controlled disease. The 5-year survival rate for Stage 1 myeloma can range from approximately 50% to 70%, depending on various factors. Late-stage multiple myeloma, Stage 3. Late-stage myeloma is associated with a less favorable prognosis, but it's essential to remember that individual responses to treatment can vary widely. Advances in treatment options, including novel therapies, have improved outcomes for some patients with advanced stage disease. The 5-year survival rate for Stage 3 myeloma may be lower, with estimates ranging from approximately 30% to 50%, again depending on various factors. Promising therapeutics for multiple myeloma recent years have witnessed significant progress in multiple myeloma treatment, with several promising therapeutics undergoing FDA approval processes. Some notable approaches include immunomodulatory drugs, IMIDs. Medications like lenalidomide and pomalidomide have demonstrated effectiveness in treating myeloma by enhancing the immune response against cancer cells. Proteasome inhibitors, drugs such as bortezomib, carfilzomib, and ixazomib inhibit proteasomes within cancer cells, leading to cell death. Monoclonal antibodies, targeted therapies like daratumumab and elotuzumab have been approved for use in myeloma treatment. Autologous stem cell transplantation. This procedure involves collecting and freezing a patient's healthy stem cells, administering high-dose chemotherapy to kill cancer cells, and then transplanting the healthy stem cells back into the patient to regenerate healthy bone marrow. Chimeric antigen receptor T-cell (CAR-T) therapy. CAR-T therapies, such as idecabtagene viclucel (ide-cel), have shown promise in treating relapsed or refractory myeloma. One website to look up promising multiple myeloma clinical trials is onclive.com. Intravenous vitamin C has shown promise against multiple myeloma. This treatment, as well as others, are described in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. Why multiple myeloma is a tricky cancer. Multiple myeloma presents several challenges that make it a complex and tricky cancer. Incurable nature. Myeloma is considered incurable, and treatment focuses on managing the disease and achieving remission. Heterogeneity. Myeloma is a heterogeneous disease with various subtypes and genetic abnormalities that impact treatment response. Bone involvement. Myeloma often affects bones, leading to bone pain, fractures, and other complications that require specialized care. Late effects. Patients may experience late effects of treatment, such as neuropathy, anemia, and kidney problems, which require ongoing monitoring and management. FDA-approved medications for multiple myeloma. Several medications have received FDA approval for the treatment of multiple myeloma. Some examples include lenalidomide bortezomib, daratumumab, carfilzomib, pomalidomide, elotuzumab, ixazomib, panobinostat. These drugs are used alone or in combination, depending on the stage and specific characteristics of the patient's myeloma. Risk factors for developing multiple myeloma. While the exact cause of multiple myeloma is not fully understood, several risk factors have been identified. Age. Myeloma is more common in older adults, with the risk increasing with age. Gender. Men are slightly more likely to develop myeloma than women. Race. African Americans have a higher risk of myeloma than white Americans. Family history. Individuals with a family history of myeloma may have a slightly increased risk. Monoclonal gammopathy of undetermined significance, MGUS. MGUS is a precursor condition to myeloma and is associated with an increased risk of progression to myeloma. It's important to note that while these factors may increase the risk of myeloma, many people with these risk factors do not develop the disease. Organizations and resources for myeloma treatment. For individuals living with multiple myeloma or seeking more information and support, several organizations and resources are available. Multiple Myeloma Research Foundation, MMRF. MRF is dedicated to accelerating the development of new treatments and therapies for myeloma patients. They provide educational resources and support. International Myeloma Foundation, IMF. IMF offers a range of resources, including patient education, support groups, and advocacy efforts. Leukemia and AMP Lymphoma Society, LLS. LLS offers resources and support for patients with multiple myeloma, including information on clinical trials and financial assistance programs. Online support communities. Websites and forums like Myeloma Central and the Multiple Myeloma Research Foundation Community Gateway allow patients to connect with others facing similar challenges. In conclusion, multiple myeloma is a complex cancer with unique challenges, including its incurable nature, risk of relapse, and diverse subtypes. However, ongoing research and advances in treatment offer hope for improved outcomes and a better quality of life for patients. Accessing support and resources from reputable organizations can also be invaluable for individuals and families affected by multiple myeloma. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.